Hey everyone, welcome back to Steve's View. Today we're going to unpack one of the biggest controversies in Washington at the moment. It's about public health, food policy, and politics all colliding in one messy, complicated fight. And at the center of it is a man named Robert F. Kennedy Jr., appointed by President Trump as Secretary of Health and Human Services. So here's the story. When President Trump named Robert F. Kennedy Jr. to head up Health and Human Services, it immediately set off alarms in Washington. Kennedy isn't just another bureaucrat. He's pushing a major agenda called Make America Healthy Again, or MAHA for short. And his program is not about more hospitals or more drugs. Instead, it's about going back to basics: food, nutrition, and lifestyle. He's calling for a complete overhaul of America's dietary guidelines, and that's where things get heated. Because if you change what the government says people should eat, you're not just shifting culture, you're challenging industries worth billions of dollars. Think food manufacturers, agribusiness, and even pharmaceutical companies that profit from the illnesses linked to poor diets. Now, why does this matter? Let's look at some numbers. Almost 1 in 5 American children is classified as obese. Chronic diseases like diabetes, heart disease, and obesity-related illnesses cost the U.S. trillions of dollars each year. And a lot of this traces back to food, what we eat, what's cheap, and what the government encourages us to consume. So when Kennedy says, we need to rethink nutrition from the ground up, he's touching a nerve that cuts across politics, science, and big business. Unsurprisingly, the pushback has been fierce. At his first Senate committee hearings, Democratic senators tore into him, some even calling him a liar and demanding his resignation. Beyond Congress, there's been a coordinated campaign against him. 9 former CDC directors signed an open letter criticizing him, and about 1,000 current and former HHS employees also signed a petition asking him to step down. That's not nothing. That shows an organized effort to undermine his authority before his policies even get off the ground. On the other hand, supporters argue, why should he resign before he's even had the chance to implement his program? They say the controversy reveals how threatening his agenda is to powerful interest groups. Here's where it gets even more political. Last December, right after Trump won the election and before Kennedy officially took office, the outgoing Biden administration rushed out the new federal dietary guidelines for 2025 to 2030. In theory, these guidelines should be based on the latest science. In practice, critics argue they're loaded with woke buzzwords and concessions to industry. For example, the guidelines call for reducing meat consumption. In part to address climate change, they promote seed oils over traditional fats, and they add a layer of equity analysis, measuring nutrition through the lenses of race and income. The idea is to make guidelines more socially conscious, but critics argue it makes them less clear, less practical, and less focused on actual health outcomes. Now let's talk about conflicts of interest. A watchdog group analyzed the Dietary Guidelines Advisory Committee, or DGAC, the panel that shapes these federal recommendations. Out of 20 members, 13 had potential conflicts with the food, pharmaceutical, or weight loss industries. Another study found that 95% of members had some kind of tie to major companies like Nestle, Abbott, Kraft, and General Mills. That doesn't necessarily mean their science is invalid, but it does raise questions about independence and transparency. If your paycheck or research funding depends on big food or big pharma, can you really give neutral advice? So what is Kennedy actually proposing? He wants to tear up the Biden-era guidelines and start from scratch. His MAHA committee, in its first closed-door meeting this March, said it would build a new set of guidelines based on real science, not political science. That means more natural fats, including whole milk and even raw dairy, less reliance on seed oils, a move away from ultra-processed foods, artificial additives, and colorings. Essentially, He wants to shift America back toward more traditional, less industrialized diets. Whether or not you agree with every detail, the principle is clear. He's challenging decades of nutrition advice that has often favored low-fat, processed alternatives. Supporters say this is long overdue. Critics warn it could backfire by encouraging unhealthy eating habits if not carefully grounded in evidence. There's another controversial part of this story: vaccines. Kennedy has long been skeptical of vaccine mandates, especially for children. He points out that during COVID-19, Americans were told certain things about vaccines, that they would stop transmission, that side effects were minimal, that even healthy kids needed the shots. Later, some of those claims were walked back or reevaluated. Critics say his rhetoric fuels distrust in vaccines at a time when preventable diseases like measles are making a comeback. In fact, just last week, a senator even tried to blame a recent measles outbreak on Kennedy's influence. His defenders argue the real problem is not skepticism, but bad leadership during the pandemic and a broken immigration system that allowed unvaccinated populations to spread across the country. Stepping back, what's happening here isn't just about Kennedy. It's about a fundamental debate over how America should handle public health. Do we double down on the current system, industry-backed guidelines, heavy reliance on pharmaceuticals, and incremental reforms? Or do we take a riskier path and try to overhaul nutrition and lifestyle advice from the ground up? This fight touches almost every household. What goes on your dinner plate? What foods your kids eat at school? What your doctor recommends? These are not abstract questions. They affect daily life and long-term health. Polls show Kennedy has strong support among Republicans, about 73% in one internal survey. But the opposition is equally strong and deeply entrenched, with networks of experts, former officials, and industry players all pushing back. That dynamic makes this one of the most polarizing cabinet appointments in Trump's second term. It's worth remembering that America's dietary guidelines have been controversial from the beginning. Back in the 1970s, the government's first attempt at food recommendations sparked fierce debates. Should we emphasize cutting fat or cutting sugar? Should the government even be telling people what to eat? Every update since then has involved fights between science, politics, and commerce. In that sense, Kennedy is just the latest figure in a long tradition of nutrition wars. So, where does this go next? If Kennedy survives the political pressure, and that's still an open question, his MAHA agenda could reshape nutrition policy for years to come. That could mean school lunch programs look different. Food labeling could change. Federal subsidies might shift away from some products and toward others, and the overall tone of U.S. health policy could move from treating disease to trying harder to prevent it. But if the opposition succeeds, if Kennedy is forced out, then the Biden-era guidelines will stand, and the chance for a major reset will vanish. The stakes are that high. At the end of the day, Americans are caught in the middle. On one side, you have an official trying to challenge the status quo with all the risks and potential rewards that come with bold reform. On the other side, you have an entrenched system that may be flawed, but also reflects decades of accumulated knowledge and infrastructure. The truth probably lies somewhere in between. Yes, conflicts of interest are real and need to be taken seriously. Yes, our food system has produced massive health problems. But no, there are no easy fixes, and simply flipping the script on decades of nutrition advice could also cause unintended harm if not done carefully. So what do you think? Should Kennedy be given the chance to carry out his Make America Healthy Again plan? Or do you think his critics are right to be worried? Drop your thoughts in the comments below. I really want to hear what you think about this one. If you enjoyed this breakdown, please give it a thumbs up, subscribe if you haven't already, and share this video with anyone who cares about health and policy. Thanks for watching, and I'll see you in the next one.